First. And I'm going to sit back here. You guys got to get in a circle together. And so you got to come up here on a chair only. Come on, you guys. Tiana, Chris. Be a team player. Won't kill you. No one has to answer if they don't choose to. So I'll be fair that way. We won't put anybody on the spot. Because the one girl who hardly ever missed a question said, I hadn't studied yet. No one had. I mean, but I didn't make anybody answer that didn't want to. So no one has to. So I'll at least be fair there. But sometimes you guys know a lot. And sometimes it's nice you guys talking and not just me. Okay? Oh, I thought your nose was bleeding. Okay. Come on over, Stephen.
Come on down.
Okay. So how this works. Call it class meeting in class. I ask the question, someone raises their hand, and I toss the thing. They keep it. The next question, you pick who. Someone raises their hand, and you pick. And then it goes so on. If you don't want to participate and you just want to listen, that's perfectly fine. No one is made to answer if they don't want to. So I'm not putting anybody on the spot. Okay. Question. Everybody have their scenarios? Because this is going to be, besides platelet function, you already know that's a 10-point question. These are going to be case studies like this on the test too. So I figured it'd be good to start with it. So we're going to start with those two questions first. We'll do this, then we'll do the platelet function and a key thing, because I think that will be good for you to see part of the essay. So bring a chair, Jen, join the group. Okay, number one. And well, how we're going to do this is when I ask about patient history, type of bleeding, abnormal screening, drug history, that's each one question. So you want to bring your chair around. You just need your case histories, even if you didn't do them. Okay, so mark all of the 4 areas for analyzing a hemostasis problem that are abnormal and determine what the problem is. Primary hemostasis involves vessels and platelets only, or B involves the clotting factors too in secondary hemostasis. Assume there is no medication if it is not listed. Okay? So, the first question I'm going to ask on number 1, so you raise your hand, no one just shouts it out. What is an abnormal lab test, if anything? So who was that?
All right.
So raise your hand. So you said, what's abnormal?
The BT.
Okay. So tell me, this is question 2. Based on a 53-year-old man recovering from an operation, oozing was noted at the surgical wound. The following lab test results were noted. And this is right away, oozing was noted. This is not saying 2 days later. Okay? Right away. So, patient history is question 2. Is this genetic or acquired? Someone raise their hand. Okay. So you got to catch it.
Acquired.
And what would be your clues it might be acquired?
Because then they say like he had a long history or.
No long history. Was there any other family members?
Yeah.
So does everybody see that was probably an acquired, not a genetic? Okay, question number 2. What type of bleeding was it? So someone raise their hand before you answer. Okay. Oh, here's one. Pass it.
Is it superficial?
Okay, so it was very superficial, just at the little wound site. Kind of like when we did our bleeding time, that was very superficial. And what would have been an example, this could be another question, if it would have been a deep bleed. Can anybody give me an example of a deep bleed term? Anyone? Hematoma, anybody give another example? Especially if we were talking about hemophiliac,
Hemathosis.
hemarthrosis, joint bleeding, okay? We already did the abnormal screening test. Katie said that was a bleeding time. Was there any drug history affecting this case study? Anybody?
No.
Okay, it wasn't listed, so we assume the patient was on no medication. So, the ultimate problem is this primary or secondary hemostasis the problem?
Primary.
Okay, so does everybody see, we had the elevated bleeding time, we had no drug history, we had superficial oozing, we had, and what's the bleeding time assess? Anybody want to raise their hand? What's the bleeding time assess?
Platelets.
Platelet what? Function. The only way a bleeding time will be abnormal is if it's a very, very low number. Ultimately, it's how the platelet functions. Okay, problem number 2. 27-year-old man had a long history of abnormal bleeding with deep bruising from minimal trauma. His other brother did too. His lab results were as follows. Question number 1. Is this genetic or acquired, and why?
Genetic, because his brother had it.
And what about himself?
Oh.
He had a long history, okay? Question number 2, what kind of bleeding is he showing? Okay, why?
Because it's a deep bruising for
Minimal trauma, and he had deep bruising, okay? And question number 3, what was abnormal screening test?
It's the PTT because it's 45 seconds and the normal range should be 28 to 36.
Now, you know, you can tell me down to what 4 factors. Anybody want to tell me what 4 factors if it's only the abnormal PTT? Want to raise your hand?
Sorry.
12,
You get more aggressive later. You go wailing it.
12, 11, 9, and 8.
Okay, and what do we know? You're going to learn in disorders, 8 is hemophilia A, 9 is hemophilia B, 11 is hemophilia C. So you already are building in your small time coag what you do know. And it fits to have these results for a person, they might have a hemophilia. And next question, is there any drug history?
No, there wasn't. It wasn't listed.
Okay, nothing listed. So then tell me what kind of hemostasis problem, primary or secondary?
I'm going to say. I don't know.
Anybody ready to raise their hand?
Or, she could.
Secondary.
And it's clotting factors involved, so it's secondary. Deep bleeding involved is secondary. Okay? So you're gonna have questions like this on your case studies too. Third one. 50-year-old female had surgery on Monday, had pre-op testing done on Friday. She had taken aspirin for a migraine on Thursday night. Her pre-op results were as follows. Question number 1, patient history, genetic or acquired?
Acquired.
Okay, so we're gonna see what ends up causing it, but it's not like she had some kind of any history showing, any family history, any long-term. Question number 2, any bleeding? Yes, go ahead.
Oh, really? Okay.
You were the only
I
one?
put it in A.
Yep, there's none shown. Question number 3, any abnormal test? Bleeding time. Now, question number 4, why? Okay, question number 4, any drug history?
Yes, she took aspirin Thursday night.
Now, question number 5. Why would the aspirin affect the bleeding time? Anybody?
You wanna do it?
Doesn't it affect like the cycloogenase?
Oxygenase. And tell me, why do you need cyclooxygenase?
We cycle oxygenase to release the granules.
Oh, to make what to release the granules? Christine?
TXA2.
Okay, then TXA2 releases the granules.
Oh,
Okay, it's a key enzyme in making TXA2.
so you have to know like the whole.
Mm-hmm.
Okay.
Mm-hmm. So, what could be a problem caused if they weren't taken off off the aspirin for at least a week before she had surgery? What problem, primary or secondary?
No?
What does go ahead, keep going.
I didn't hear what you said.
She said secondary.
Oh, well, yeah, I had primary.
Why?
I just thought primary because I should have I had it wrote down, but I don't know why.
Anybody think why it would be primary? If the person ends up bleeding, why are they gonna have a primary type of bleed? What did you just tell me they affected? Trey?
Yeah, the primary affects the vessels and the platelets, so therefore.
What are you not being able to do if you can't make TXA2?
You're not being able to start the primary.
The platelet plug, because what does TXA do? Releases the granules, right? Which makes better platelet-to-platelet aggregation. So it's gonna cause a platelet primary problem. Remember, vessels and platelets, when they're affected, it's a primary hemostasis. The aspirin isn't doing anything to your clotting factors. They're hanging out there waiting perfect shape. It's you messed up your platelet aggregation. You can never get to secondary aggregation because you couldn't release the granules.
That's why I put secondary. Because I was like, well, you're never gonna get there. So
No, that's still only primary because it's only affecting the platelet. Secondary is when the clotting factors are affected. If we'd have given the drug Coumadin or heparin instead of aspirin, it would be a secondary hemostasis. Because what did you just learn today? 4 factors that are dependent on vitamin K that Coumadin affects. 2, 7, 9, and 10. Okay? Or if I put you on heparin, it's going to affect your factors. I'll teach you heparin affects every factor but 7 in the clotting process. So heparin and Coumadin would have been triggering secondary hemostasis problems. Aspirin affects your platelet function, so it's a primary. Remember, vessels and platelets go with primary hemostasis. Clotting factors go with secondary. Okay, let's move on to your next essay question. What is the first step in platelet, well, let's do this, but yeah. What's the first step in platelet plug formation? Anybody want to raise their hand? What are 2, give me one key thing with platelet adhesion?
Von Wilder's,
Oh, raise your hand.
the Von Wilder's factor.
VWF plus, what's your second piece? That's from the vessel, GP1B. So the vessel releases VWF, GP1B is what's on the platelet peripheral zone, and they form the first line of platelets blocking the injured vessel, platelet adhesion. What is the second step?
Primary aggregation.
And you have 2 choices you can give me on, so what is one thing you could write, because you only have to give me one key thing for each step. What would be a key thing you could give me?
Formation of TXA2.
Okay, that's one. And what is a second one? And someone can raise their hand. Anybody want to try? What glycoproteins?
2A and 1B.
2B
2B
and 3A plus calcium
and 1.
and factor 1. So on your test, I only need one key piece. You don't have to give me both. As long as you give me one accurate one, that's good. Yes.
If we give you them both, could this be counted as extra credits?
No.
Okay.
You only have to give me one. What's the third step? If anything comes good of this, you guys see what you don't know to study. You know, so you learn a lot. You see what you kind of know and what you don't know. Okay, Leah,
Release reaction.
you wanna throw it? Here comes.
The release reaction in TXA2.
Okay, so TXA2 causes it, but, and I'll take one of two things on this step too. Oh, okay, Chris, you wanna go? Chris?
Yeah, exposes platelet factor 3.
Yes, that's one. What's the second thing that the release reaction does?
It was, the alpha and history.
Okay, then what's the fourth step?
Secondary aggregation,
And that's probably the easiest one. What do you know about that one?
just more incomplete aggregation.
Yeah. Why, how about this? This question might be, why is it more incomplete? Aggregation. What do you have to have or the platelet plug will not stay together? Well, you do need the granules, but there's a key piece, especially in the dense granules, that you really gotta have to have good platelet plug formation. Yep, the energy source. The little bit of ADP released when the vessel is damaged only gets platelets activated. You gotta have what's in the granules to get complete aggregation where that platelet plug will be good. And then what's the fifth step? Based on Chris, go ahead, based on what you said, what would be the fifth step then? You said the substance you needed for the fifth step.
Platelet factor 3?
Yeah, that's the key piece to step 5. Wanna try it?
What was the question?
What is the key thing in step 5 because of platelet factor 3?
Ceases release of something. Okay.
What does it allow to join to the platelet plug?
The platelet factor 3 binds the platelet plug.
It allows a fibrin clot to join the platelet plug. They call it stabilization of the platelet plug. And remember, where do we just learn today's lecture where there's PF3s?
Factor 13.
Well, there's PF3 with 9A, 8, PF3 calcium in the first box, then 10A, 5, PF3 calcium in the second box. So it allows the fibrin clot to join the platelet plug and stabilize it. Okay? So let's go to, let me get my study questions. What is the difference of coag versus hemostasis? Coagulation versus hemostasis.
Hemostasis is smooth continuous blood flow, and coagulation is trying to form the clot,
Okay.
the fibrin clot.
And what is the difference between primary hemostasis and secondary? What is involved? What systems are involved with primary? What systems are involved with secondary?
Yeah. Oh, yeah, sorry.
Platelet to vessel for primary and platelet to platelet for secondary.
Secondary is clotting factors. Secondary hemostasis is the clotting factors joining the platelet flood.
You answered for aggregation.
Oh, aggregation, okay.
I mean, primary hemostasis is platelet and vessels are involved. Secondary hemostasis is the clotting system, clotting factors, fiber clot joins the platelet flood. Okay, so once you get into secondary hemostasis problems, it's your clotting factors you're looking at as a problem. What are the vessels in the vascular system?
Veins, arteries, arterioles, capillaries.
And venules.
Oh, venules.
What are two inhibitory substances from the endothelial cells? We talked a lot about the one, we didn't talk much about the other. There's two choices.
ADPase, the enzyme that breaks down ATP, and
There's thrombomodulin.
Yeah, thrombomodulin.
ADPase is the big one to know. That one degrades any extra ADP that, once you got your platelets aggregated, you don't want.
What is TPA? Is it tissue?
And that would, let's put that one instead. You got your key out? Let's do 4, put TPA and ADPase. Tell me what TPA does. It's number 4 on your study guide. Put TPA and ADPase. Or just write it on a note to yourself. Tell me what TPA does. You know the name, what it stands for? Tissue plasminogen activator. So tomorrow you'll learn it's one of the things that triggers plasminogen to plasmin. And what's good about it, it does it very localized at the fibrin clot. So if they give someone an injection of TPA, like if they come in for a heart attack, it's going to be more, it'll minimize or make the damage minimal if they can give them that injection pretty quickly. There won't be as much damage to the heart muscle. So it is something that tries to stop clotting. ADPase tries to stop activation of platelets.
So, I'm sorry, what was that question you asked about, when she gave me baby?
ADPase, what are two inhibitory substances produced by the endothelial
the
cells?
one hemostasis that
Her question was the difference of hemostasis and coagulation. What are two, yes,
Sorry, what did you say TPA does?
TPA, it activates plasminogen to plasmin.
Did you know you had two, I forgot to ask you about that too, it was 2 study guides in the, this book right here, it was 2 different.
You only had to do overview of hemostasis and platelets and vessels.
Yeah, it was one that said we going overview, and then the other one was overview, it was 2 of them.
But I have probably extra worksheets in there too. The study guide should say study guide.
Okay.
all the study guides are like the last things. in
They're the very last pages. I have extra worksheets in there that I used to use any other time I taught it. Some, like the clotting factor worksheet. The study guide is what you gotta know for your test. I don't assign all the other extra worksheets. I'll let you know if I ever assign.
Yeah, I had like the question, I didn't know which one, I forgot to ask you.
Yeah, this, mine says study guide. So it should say study guide. Okay, what are two thrombotic substances or cause clots that are released from the damaged vessel? Okay, Stephen?
VWF and factor 3.
Okay, so VWF helps what? What is it involved with? Someone else can answer, I don't care. What does VWF go with? What does it do for hemostasis? Whoever just answered platelet adhesion should be able to tell me.
You said, what did you
What does VWF do for you? Who answered platelet adhesion? So what's VWF work with? To do what? What's your first step of platelet function? Anybody? I'm not trying to put you on the spot, I'm just reviewing.
It binds to glycoprotein
Protein.
B.
To do, what's the function? Platelet
Platelet adhesion.
adhesion, okay? And then what's factor 3 do? We just reviewed today. Anyone?
Triggers extrinsic factors.
Extrinsic system, so it starts the extrinsic clotting system. We already went over number 6, 4 key, well, this is a good one from number 6. What are the 4 screening tests for coag? They might do like on a pre-op patient or,
Bleeding time, PT, PTT, and platelet.
platelet count. Platelet count you'll get from a CBC in hematology. That's where that's housed. There's a test called the PFA 100. Some of you will get to see instead of a bleeding time that some have an analyzer that assesses platelet function. And we already kind of talked about tell me 2 examples, terms of superficial bleeding. We already talked about deep bleeding with hematomas, hemarthrosis. Anybody give me some terms for superficial bleeding?
Petechial
Petechia.
and
Another P. Purpura.
Petechial.
Anybody else know where else you can bleed that's superficial?
Is it your intestines?
Any kind of mucosal bleeding, whether it be mouth, dental, GI bleeding, heavy periods, any mucosal bleeding is considered superficial.
I have curiosity, why? Why is it considered superficial, but it's still inside your body, like the GI system?
But it's the inside of the lining, it's more
Okay.
platelet and vessels are involved if there's any bleeding issue.
Alright.
But any mucosal bleeding is considered that. What are the 4 major systems in hemostasis? You've learned 3 of them. Katie?
I think,
I'm sorry, I did not see you. Looking around.
I think it's the fibrinolysis.
It's 4.
Platelets, vessels, and clotting factors.
Mm-hmm. And what are the 3 minor systems in hemostasis? We'll learn them tomorrow.
The protease, inhibitors, kinin system, and complement system.
Okay, so the kinin system, we've already at least learned the names of 2 of them, prekallikrein and high molecular weight, so Fitzgerald or Fletcher. And protease inhibitors, you already saw 2 today, protein CNS. And we're gonna see complement's major role is the immune system. So when you have Diane in immunology, you'll learn the complement cascade. It does help phagocytosis and help you fight bacteria especially better. But it does have a minor role in coagulation that we'll learn about tomorrow. So the minor systems, I won't expect you to know much when we get to them tomorrow, but they're still critical pieces. Okay, tell me, how does the vessel help hemostasis when you've had trauma? We already know it released VWF3 activated platelets. What are 2 other things that it can do? The vessel. Who has our little
Vasodilation or constriction.
vasoconstriction, not dilation, flows off.
And just the tissue factor.
Well, we already talked about what it can release. It can divert your blood flow, so diversion of blood flow.
Wouldn't that be the dilation of other?
No.
vasodilation?
Dilation would be that one vessel expanding. Diversion, it can divert different pathways. what are 3 characteristics of platelets? Anyone? What shape is it? How long does it circulate?
We have a discourse shape,
Okay,
it circulates 9 to 12 days, and, 150,000 to 400,000 PTT/cm.
okay, so, and I know on my key, I still have it as 450, but I won't take off if you put 400 or 450. It just depends on your book or your lab, but the book actually says 150,000 to 400,000. So name the 3 zones of the platelet.
Peripheral zone, solgal zone, and organelle zone.
And what is another name for peripheral zone? Transmitter, what's another name for the organelle zone?
Metabolic.
Okay. What are the 3 glycoproteins in the peripheral zone?
It is glycoprotein 1B, glycoprotein 2B, and glycoprotein 3A.
Okay. And what is the job of, and what is the big canal system, the main one that releases granules to the outside? They talk about it in the peripheral zone.
OCS.
Okay, the open canalicular system. And what is the main job of your sol gel zone?
To change the shape of the platelet.
Okay, so normally you're gonna go from disc, when it gets activated, it's gonna go to circular, and it's gonna line up all your organelles to be released. And what are the 2 granules that I'm having you know in the organelle zone?
Alpha and then,
And what are 2 key things in the alpha?
VW web and factors 5 and 1.
Okay, and what are the key things in the dense?
ADP, ATP, and calcium.
Okay, and which one is the most numerous of the 2? The alpha. I think there's 2 to 10 dents per platelet and 20 to 200 alpha per platelet. We already did the 5 steps. And tell me what are critical things on the bleeding time?
Must be between 2 to 9.
2 to 9 is the normal. What could you do as a tech to mess it up?
The paper on like the actual puncture versus the bead of blood.
Okay,
Having the blood pressure set it to 40.
that's a key piece. If it's too low, you won't get enough bleed. If it's too high, you'll bleed too long. And tell me, you already know what are your factors in the ProTime test? Anyone? So 3, 7, 2 and 1. And we already know if the ProTime is elevated by itself, what is the factor? 7, because it's the only one isolated to it. And what is the reagent for the ProTime? Tissue thromboplastin, and it already has the calcium added in it. And then you just have your questions from the book. So do you guys have any other questions? And let's do your clotting factors name. Let's go over them all together again. So 1, hydrogen. 2, 3, She Rumble Preston. 4, 5, 6,
Unidentified.
7, 8, 2,
Wait, what?
Factor 8.
Anti-hemophilic and labor.
9,
Christmas factor.
10,
Superpower.
11.
Plasma bronchoplastin.
Antecedent. 12, 2.
Hickman.
Hickman. Factor 13. Does its job. Fibrin stabilizing factor. Precaliprin.
Fletcher.
HMWK. Kininogen. Fitzgerald. And then the questions, if anybody needs to copy them, page 629 to 30, level 1, level 2, and then the answers are in the back. So, other than that,
629, 630.
it is page 629 to 630 on your review sheet.
Did you post that?
Uh-huh, everything was posted
I
Friday.
didn't see the review sheet.
I saw it on week 3. I didn't look at week 1 or 2 technically yet.
I'll check, but I'll make sure.
Because there would have been a good test review.
It wasn't.
Yeah,
Yeah, it's not there.
let me just go copy them real quick for you, that way you have it and you don't even have to print it, sorry. So they picked it up. Let me give you this, and then if anybody needs to copy or take a picture of the questions, if you guys don't mind putting back the desk.
Future work.
It's online.
Print it out, right?
Yeah.
Okay.
Yeah, she put her answer